Here's a look at some of the stories we're following this hour. We're going to begin with breaking news. The U.S. Supreme Court has granted the Biden administration's request to enforce nationwide vaccine rules for healthcare workers. However, at the same time, the court stopped the administration from imposing a vaccine or test rule on American businesses with at least 100 employees. The court found the government was overstepping by requiring employees to be either vaccinated against COVID-19 or undergo weekly testing and always wear a mask. For more, I'd like to bring in CBS News legal contributor Jessica Levinson. Jessica, good afternoon. How significant is this decision from the court?
It's a really big decision. It's a really big decision, practically speaking, because it affects the mandates that we live under. It's a really big decision, politically speaking, because, frankly, it's a big setback for the Biden administration. And it's a big decision legally, because it tells us a little bit about where this court is going when it comes to the use of executive authority, when it comes to the use of, I should say, executive agencies' authority. Because we had this executive agency, OSHA, that was trying to say, we have emergency powers here. Supreme Court really slapped that down. So practically, politically, legally, it's significant today, for sure.
Yeah, it was a key part of the Biden administration's strategy for combating the virus. It's interesting that the court has gone along with mandates that states have imposed, but here there's a federal attempt, and we get this split decision. For most federally funded healthcare facilities, however, the mandate does go through. What do you think led to that particular decision?
So if I could go back to the first thing you said, I think it's so important, which is people might be saying, well, what changed? Because the state was upholding these mandates when it came to states or localities, or they were upholding more restrictions when it came from states and localities. So do they just hate the federal government? And the answer is that it comes from a very different source of legal power. When we're talking about states or counties or cities, and they want to impose vaccine mandates, that comes from the sovereign power of states, their police powers to implement health, safety, welfare restrictions for us, to protect us. That's a really broad power. For the federal government, what we're seeing today is not as clear where it comes from or how broad that power is. To get to your question, in this case, the court's saying, no, OSHA, you went outside your lane. You need Congress to authorize if you want to do this. You need Congress to give you more authority. When it comes to the healthcare workers, a narrower decision, here we see the court saying, look, if you get Medicare and Medicaid, you're getting something from the federal government. It's fair for us to ask for something from you. It's fair for us to put more restrictions on you because we give you something in return for being able to do that.
All right, we also have Jan Crawford with us. Jan, I want to go to you for a moment. Your reaction, if you could, right off the top here, to this split decision on the Biden administration's mandates, vaccine mandates, and a key part of their COVID-19 strategy.
Sure. I mean, I got to hear some of what Jessica was saying, and I mean, that's just great analysis and laying out some of the legal issues. I'm not surprised by the ruling myself at all. I think it was telegraphed pretty clearly at the oral arguments that you had those three liberal justices adamantly in support of allowing this kind of mandate, sweeping mandate, to take effect in light of the unique dangers that COVID presents to our workforce. And then you had the six more conservative justices saying, like, wait a minute. I mean, the federal government has never done this before. To Jessica's point, it's very different than state mandates. Federal government's never done this before. And, what are we doing here? So they were much more sympathetic to the arguments for the healthcare workers. That's more narrow. It's easier to back up because of the Medicare, Medicaid funding that the facilities get. So, I think that the ruling today, again, you hate to predict coming out of oral arguments, but I think it really tracked with what we heard in the courtroom. And so, I'm not surprised. I mean, if the court had ruled that the federal government, for the first time ever, could say some 85 million people working at these big private businesses had to be vaccinated or weekly testing and masks, that would have been a pretty extraordinary expansion of authority, I think.
So the Supreme Court is the end of the line, legally speaking. There is no appeal at that point. However, is it possible, Jan, for the Biden administration to rewrite this rule with different language, more tailored language perhaps, and take another swing at it?
Well, first of all, they're just blocking this from taking effect while some of the legal issues play out in the lower court. So technically, I guess, you could kind of see this case come back, although the court, in its opinion, makes very clear that this isn't going to fly with them today, tomorrow, ever, the way this is written right now. I do think that's an interesting question, though, because during the oral arguments, Justice Barrett, a conservative, of course, President Trump's nominee, she was asking questions about how, what if this were kind of more surgical, targeted to, say, workplaces that had unique dangers, like meatpacking plants? This is so sweeping, it applies to everyone. COVID, doesn't just affect the workplace. How can you justify this rule at every workplace? It affects you when you're at home or, wherever you may go. But what about those workers who are in a unique position, potentially more danger from COVID because of their working conditions? So potentially, yes. You may be able to get, a little more from this court if the rule were rewritten to kind of focus more on some of those workplaces. That's a great question. I don't know if they're going to do it or not.
Jan, that's interesting. Yeah, that becomes a political question whether they do it. Jessica, if you still are with us, I want to put the same question to you, given what Jan was saying about Justice Barrett's line of questioning. Do you read it as possible for the Biden administration to potentially more closely tailor the language of one of these mandates and get it through next time?
I think Jan hit it out of the park when it comes to answering this question. So I think she's exactly right that the Biden administration has a decision here. And when I heard Justice Barrett ask that question in oral arguments, you immediately envision that she's thinking the Biden administration has used a sledgehammer when they could have used a scalpel. And I think that's a lot of what the conservative justices were saying here, which is, can't we find a way to do this that's a little less blunt force? Now, so the Biden administration has a decision. Now, it is also possible, although I think desperately unlikely, that Congress could decide to grant OSHA greater authority. So there's two groups really who could take another stab at this, but it's a withering opinion in terms of finding that the Biden administration really went too far on this. It will be, I think, largely a political decision, and they'll look at where they think the course of the virus is going, what's going to happen in the midterms. I mean, it's crazy, but it's true that these decisions will be based on when the election is and where we are in a surge.
Yeah, that's Congress for you. A sledgehammer, not a scalpel. Some great analysis there from Jessica Levinson and our Jan Crawford. Thank you both for your time and expertise.